Hi, everybody. Thank you so much for joining us today for this event. And I'm welcoming the admissions representatives from University of the Pacific to present their program to us today.
Hello, everyone. My name is Dr. Masakia, and I am the incoming chair for the University of the Pacific Audiology Department. And I am delighted to share with you today about a little bit about what is audiology and the admissions process for our graduate school. I'm going to begin by sharing my screen and showing you a little presentation that I have. Okay. So yes, we're talking today about hidden gems in healthcare, and I truly believe that audiology is a hidden gem. I personally found it to be a hidden gem. I came to audiology and hearing science from a love of neuroscience and music. And what I'd like to tell you about is that audiology is basically the field. A broad view of it is that it's a field of health professionals who diagnose, manage, and treat ear-related problems. Now, ear-related is basically two things. It consists of course, hearing loss, which is something that we think of in relationship to ear-related problems. But also in the ear, there is a balance sensory organ. So loss of balance is associated with ear-related problems. What I find amazing about audiology is that it lies at the intersection of science, technology, and patient care. And so it combines these three sections: patient care, of course, healthcare, community service, science, in that it relies heavily on research and evidence-based practice, as well as knowledge of biology, anatomy, and physiology, and technology. It intersects with technology via the assessment tools, as well as the habilitation tools that audiologists use. So regarding patient care, let's start with that first one. Providers of ear-related patient care are called audiologists. And here we see an audiologist fitting a hearing aid to a child with the caregiver in the background. Audiologists determine the type and degree of hearing or balance impairment. And once determined, they fit, dispense, and repair devices that can help remediate the impairment. So not only do they identify the problem, but they prescribe assistive devices to remediate it. The diagnosis part is really exciting. The audiologists get to determine the type and degree of hearing or balance impairment using tools for diagnosis. And the audiologist tools for diagnosis range from simple to high tech. One of our most simple tools is called the otoscope, and that's a little magnifying glass that I bet probably all of us have had it. When we go to the doctor, somebody looks in your ear and they say, oh, everything looks good, or there's a problem. That's a real simple tool. And then we also have what this person is using here, which is a computer connected to an audiometer, where sounds are presented, and the patient, this is the audiologist on the right and the patient on the left, and the patient responds whether they hear sounds or not. Even more high tech is auditory function screening units that register brain responses to sound that do not require a patient to say whether they hear the sound or not, and also neurological diagnostic sets. So really exciting tools that are used in audiology. As far as treatment, once diagnosed, the audiologist can choose appropriate care, and that's related to the type of amplification device, like hearing aids, Also cochlear implants, which are amazing pieces of health technology that allow someone who has completely lost their hearing to hear again, and brainstem implants. Now that has to be, of course, these are surgically implanted and have to be performed in conjunction with a surgical team, an ENT surgeon. But with treatment, what we find is that people with congenital hearing loss, or people who are born without hearing or severe deficits, can then gain and improve auditory function. And this is an amazing miracle of science. People who lose hearing over time. If you either have a noisy situation that causes your hearing loss, or just from hearing loss as we go through life, you can learn to hear well again. As well as people with confirmed vestibular imbalance problems can also receive therapy that mitigates or completely eliminates the impairment. So our treatment options are really great. Now, I'm just going to share with you a little minute of a video, a little part of a video about Guadalupe, who failed her hearing test at birth and who got cochlear implants. And we're going to see what it's like. This is really the joy of audiology, is having people who get to hear again.
With Guadalupe, prior to receiving her implant, she was relying on her hearing aids. She mostly used sign language to communicate. Now that she has her implant, our goal is to, teach her some listening and spoken language. Yes, you heard that. And I did present some sounds to see if she responded to them. She looked and smiled. Did you hear it? Put it in. Put it in. Put it in.
I think it's exciting for everyone, not only the professionals helping her, but the families. They get to see their reactions. So overall, it's just a wonderful experience.
Lupe, hey, ¿qué pasó? Mami, ¿me oyes?
It's going to take some time with speech, but at least that we're stimulating those nerve pathways, right? So she's understanding and says, oh, I hear a sound, even
Oops, sorry, Beth.
though she can't quite make out what it is, but eventually getting her to that point.
So that's a little bit about what some audiologists who work in that area get to experience. Regarding the work environment of audiologists, most audiologists work full-time. They can work with nurses, audiology assistants, ENTs, and other health professionals. Audiologists held about some stats on audiologists. They held about 13,800 jobs in 2019. And the largest employers of audiologists were physician offices. That's 20% of audiologists were employed by physician offices, where the median wage was $78,680. There were also offices of either physical occupational speech therapists and audiologists. That's another quarter of the audiologists, where they were making about the same amount, a couple thousand more. In hospitals, there's 16% of audiologists works in hospitals and their associated wage, and educational services such as state, local, and private services, 10% of audiologists were engaged in that work environment. So there's a variety of work environments for audiologists. What happens? What do you do? What's the context? According to surveys of over 800 audiologists, they reported that every day brings face-to-face contact and discussion with patients or teams. So there's a lot of personal contact and interrelations. 77% of audiologists say that they have freedom to make decisions without supervision. It's a very empowering job. And 67% of audiologists say that they have to make decisions that affect other people every day. So it's a very powerful, empowering profession in which you can really affect other people's lives. Some of the activities that audiologists engage with are documentation and recording information, of course, working with people, working with computers, and interpersonal relationships. The job outlook is very good for audiologists. It's expected to grow much faster than the average for all occupations. All occupations are expected to grow 4% from 2019 to 2029. Now, I don't know how COVID has affected this, but healthcare and diagnosing, treating practitioners are expected to grow about 10%, and audiologists are expecting to grow more than the typical healthcare diagnostics. And that is largely due to an increase in aging population where people do lose their hearing, and advances in technology that make them more appealing to a wider variety of people. So I hope by this time you're wondering how to become an audiologist. The doctoral degree in audiology is a graduate program that takes about 3 to 4 years to complete, depending on your program. Graduate coursework includes anatomy, physiology, and physics, diagnostics and treatment, as well as supervised clinical practice. And graduation from a program allows you to get a license in most states. Oopsies. At University of the Pacific, we have 2 clinics, one at San Francisco and one at Stockton. And in the first year of education, students work in-house with what are called preceptors or clinical supervisors. And we train them to know how to perform these diagnostic tests and fitting hearing amplification devices. In the second year, students go out beyond San Francisco Bay Area to the wider Bay Area to do what is called their internships, where they go to different clinics 2 days a week and get a taste of clinical education from other clinicians. And in the third year, students go on an externship, which is a real job and sometimes is paid. And we have students everywhere from Hawaii to Washington, D.C., mostly in California, but are going everywhere to learn more about their clinical education. And I'll wrap up by saying that the Doctor of Audiology student experience at the University of the Pacific is a varied and rich dynamic experience. There are student organizations, the academics are incredibly rigorous. We have volunteer and humanitarian opportunities in non-COVID times. You get to see a lot of the Bay Area, great clinics in the area, as well as work with our fantastic faculty to learn about research techniques and volunteer for research projects. So I'm going to skip this video, but this was a video that was made by our students, and it shows the audiology experience. Maybe sometime in our information sessions or open house, we'll get a chance to show you. But I'll end with the contact information. If you're interested in hearing more about audiology or applying at University of the Pacific, you can email pacificaud@pacific.edu or contact us by phone. I am so happy to have shared my passion for audiology and my passion for audiology education with you. And I look forward to taking any questions and the rest of the webinar. Thank you.
Thank you so much for the presentation. And I just want to add that we have 3 graduate students also joining us from the University of the Pacific. Marjorie, Sita, and Kiana can share their experience at the University of the Pacific a little bit later. Right now, I'm going to invite the representative from CSUN, to share their program with us, and hopefully we can move on with the next presentation. Professor Jin, feel free to share your screen. You are muted.
Can you
There
hear
we
me
go.
okay?
Yes, we can.
Good afternoon. My name is Su Hyun-jin. I'm from CSUN, and I am a program director of a AUD program. And actually, we have another faculty member who is Dr. Striker Russo, who is a graduate coordinator of a SLP program. So after my presentation, she will talk more about the SLP, but today my focus is mainly on the AUD program at CSUN. So actually, previous presenter, Gabriella from the University Pacific, gave us a very wonderful presentation about the audiology. So today my presentation is mainly focused on our program and what we offer, and then the strength of our AUD program. So as she mentioned that the audiology is a branch of sciences that studies hearing, balance, and the related disorders. So the audiologists are the healthcare professions who treat those with the hearing loss and the balance problems due to certain disorders or due to aging, and they proactively prevent related damage. So in our program is actually 4-year cohorted graduate program. So which means that the students are each cohort, they will have the same sequence of classes, and also make a progress on the toward the graduation in the same pace. So actually, our program is relatively new. So we have 3 cohort students. So currently we have 2 cohorts, first and second. And then starting this fall, we have a 3rd cohort. And so they are in the various stage of this doctoral program. So since my time is quite limited, so I have this website inserted in this presentation. So if you want to learn more details about the AUD program at CSUN, you can go to this website to look at the timelines and information about the requirements, and then also application process. And then here, I also included my email address. So if you do have questions about our AUD program and application, you can always feel free to contact me via email. And then also we have students, Jasmine Rodriguez, who is a president of the student organization at the CSUN. And then also she is a member of the board member of a national SAA. So here is the her email address. So if you want to learn more about the student perspectives of our AUD program, you can also contact her via email. So in order to meet this the requirements, and also being the professional and then a successful audiologist, we provide a lot of practice in our in-house clinic. So we are equipped with several audiometers, audiology sound booth. And as you can see, we have some equipment, important equipment to test patients' balance, balance and then vestibular functions. So here are those like a testing setup. And then you can see the students are involved in those clinical activities. And then here, so I want to show the phase of our AUD program. So we have the first cohort, who is a truly pioneer of our AUD program at CSUN. And then we do have a second cohort student here. And as I mentioned, we are expecting about 14 incoming students. Here are the list of research opportunities. So these are the example, and then it's not limited to, but there are certain areas each our faculty member are expertise in, or they can provide this research training if you come to our program. So those are including hearing diagnostics and hearing aids and oral rehabilitation and implantable devices. So sometimes the patients with a very severe hearing loss, so then maybe the hearing aids, the technology might not enough. Then also the medical device can be inserted into auditory system. And so our facility can provide some research training on that area. And then also we do have a really good test setup for the balance diagnostic and then vestibular testing. So we do provide intensive training in that area. And that is actually one of our strengths of our AUD program. And then also students can practice different area of electrophysiology, which means that that technology really allow us to measure how our brain really responding to the sound. So the sound means like like a speech sound, or some of the environmental sound, or even like music. So how our human listeners' brain are really reacting to those sounds. So there is several different ways to measure that. So if we do have a kind of setting to provide that training. And then also we do have some speech perception and the aging research opportunities, as well as cochlear implant. So before I end my presentation, actually, I want to emphasize the strength of our AUD program at CSUN. So one of the strengths is our program is a student-centered program, which means that we try our best to provide accommodation for our students who with special needs, or who are in the certain personal circumstances, especially with this COVID related pandemic. Many students face different challenges. So we do understand that, and then so we work very hard to find accommodation for the students based on the student needs. And then also faculty and clinical supervisor preceptors in our clinic try to provide a very well-oriented, like a one-to-one, either virtual or in-person training, especially if students need a certain more practice in a certain area, and then we meet with them to improve their clinical skills and knowledge. And then also we have a very strong student relationship across the different cohort members. So especially our first cohort has been a good mentor. So mentoring new AUD students or incoming students, as well as undergraduate students who are interested in the audiology program. And then the last is we do have a very strong support from alumni across California or different states. So they are willing to provide mentorship and then also provide various clinical placement so our students can explore, can be trained in the different areas of in audiology. And then here are some requirements of our AUD program. But again, I do not have a time to go over. So if you are interested in our wonderful AUD program, you can go to the website I showed you earlier, and so you can find more information. And then here is another website I inserted in this presentation to mainly talk about the application process. So there, of course, this is a doctoral level program. So there are certain minimum requirements you need to have in order to apply. And then also there are certain application documents you need to fill out, and then also we do have an application, very rigorous application review process. So again, if you do interested in, just to go to this website, or you can always feel free to contact me if you do need more information. And so for the so here are some deadlines, and then what to do in order to apply our AUD program. So you can find more information about our application process from this website. So that's about our AUD program. Now I'm going to pass this time to our colleague, Dr. Stragaruso, who is graduate coordinator of SLP program.
Hello, I'm really happy to be able to talk to you today a little bit about speech pathology and about our graduate program. And here's my contact information, and I am more than happy to respond to questions that might come up after the presentation today. This is our facility. And we do offer 3 degrees in communication disorders and sciences, undergraduate degrees, the Master's of Science degree in speech language pathology, and the AUD degree, which you just heard about. We have 2 programs that offer the Master of Science in speech language pathology. One called we call it our stateside, is on campus. The other, through our distance learning college, is completely online. Students never come to campus, and it's quite unique. We've been offering this program for over 20 years. We were the first in the country to have an online master's degree in speech language pathology. The programs are equivalent, the same courses, faculty teach in both programs. It's just a matter of how the information is delivered, whether it's delivered on campus or through remote learning. I love our graduate students, and they are energetic, and they are passionate about helping others, but it's hard work. The master's degree is very hard work. And I included this slide to show you how diverse the curriculum is: counseling, disorder areas, neurology. It's fascinating and very diverse. Our program includes the 55 units, but of those, there are 5 semesters of clinical practicum. And Some of that will be on campus in our Language, Speech, and Hearing Center, where we offer a full range of services, really from our early intervention clinics through our neurogenic disorders clinics, where students are working with patients who have maybe Parkinson's disease or who've had a stroke or laryngeal impairments. Our students also collaborate a lot with our faculty. And I think if you ask our students who are here today, they'll tell you that the opportunities to collaborate with faculty and have faculty mentors, that's one of our strongest, I think, characteristics. I've included the link here to one of our professors' lab sites. So if you're interested, you can take a look. Maybe this, the slide presentations can be made available to you, so you can take your time later. Students collaborate with each other. They do class projects together. They do, and this is true for both the distance learning program and the residential program. They collaborate with each other. They collaborate with faculty. They collaborate with persons in the community. They collaborate with our physical therapy department and other departments on campus. And they're very active. So I would invite you to take a closer look and get to know our student groups through Instagram, Facebook, and their website on campus, the National Student Speech Language Hearing Association, the CSUN chapter of that. Our admissions requirements, I have to see how I'm doing on time. I think I have 1 minute. I have to do this fast. We do require that students have either an undergraduate degree in speech language pathology or the equivalent prerequisite coursework. And there are lots of, since you're at UCLA, you're going to fall into that second group, and you'll have to complete the 30 semester units. And this is pretty typical of graduate programs across the country, where you have to come in with the prerequisite coursework. I don't have time to go over all the details of my slides, but as you're contemplating going to graduate school and possibly completing these prerequisites, I'd encourage you to get to know the programs to which you're going to apply, so that you can make sure that the prerequisite courses you're taking are a good match to what that program requires. Because while the prerequisites are similar, there are some differences. I've included the link here to our catalog description of the courses that we require. You can plan on taking anywhere from 1 to 2 years to complete these requirements. And keep in mind that our applications become available in October. And just as Dr. Jin spoke about the audiology program, we do have a university application and separate department application. Both of those become available in October, and they're due in January completed. And across the field of speech pathology, graduate applications are typically due anywhere from the middle of December through the spring. So you'd want to check on the application deadline for any of the programs to which you're thinking of applying. Here is the information and the link to our the information about applying to our program, both the university and the department applications. And don't hesitate to contact me if you have any questions in the future. And certainly I'm here to answer questions, and so is our graduate student in speech pathology. So thank you.
Thank you so much for both of these presentations. And as I see right now, we don't have any questions in the Q&A, so I encourage our student attendees to post questions if they have it. But in the meantime, I want to invite these graduate students to introduce themselves. So from CSUN, we have Jasmine and Anna, and from University of the Pacific, we have Marjorie, Sita, and Kiana. So Anna is the first face I see on my right. So why don't you start? And please include your name, your school, your current program, and what you have studied in your undergrad.
Sure. Thank you. Thank you for inviting me today. I'm Anna Guerrero. I'm a current, an incoming third-year graduate student taking the master's in speech language pathology at California State University, Northridge. That was a mouthful. And you mentioned my bachelor's degree. So I do have my background is a little different. I am an international student from the Philippines, in which I took my bachelor's degree in speech pathology also. And so then after that, I moved here to the US for graduate studies. But my interest was really in speech pathology, and it's such a great field to discover. So I would really highly encourage students who are interested in this field to explore this field, because it has so many interesting opportunities to offer.
Thank you. Kiana?
Hi, I'm Kiana Sagaring. I'm going into my third year now at the University of the Pacific in San Francisco. And I attended Bio University for my undergraduate degree in Bachelor's of Science in Communication Sciences and Disorders. I'm currently going to be starting my externship at Stanford on the pediatric side just shortly here. So yeah, happy to be here.
Thank you. Jasmine?
Hello, everyone. Thank you for inviting me to speak. It's great to hear from everyone and see my colleagues and friends as well. I'm Jasmine. I'm from Cal State Northridge, also known as CSUN. So yes, the C and the sun, where are we at in Northridge? I got my bachelor's at CSUN, undergraduate degree in communicative disorder and sciences with the emphasis in audiology. Then I am part of the first cohort, which makes me a third year. This is an amazing field. I absolutely love CSUN. I'm glad I stayed. As the speakers did mention, the faculty has really kept my heart at CSUN, and I'm looking forward to being an alumni and giving back. I'm also the president of SAA at CSUN, which I found with multiple of my colleagues. And I'm also the incoming Education Committee Chair for National Student Academy of Audiology Board of Directors. If you have any questions, you can email me.
Thank you. Marjorie?
Hello. My name is Marjorie Meyer, and I am going to become a second-year audiology student here at University of the Pacific in the San Francisco Bay Area. I really enjoy this program. I felt like it was the best combination of it all. I got my bachelor's at San Jose State University. I got my bachelor's in communicative disorders and sciences and a minor in deaf education. I am also the SAA president here at our UOP campus, and it's just been great to connect with so many great colleagues and classmates, and I feel very supported in this program, which I think is something that I really looked for when I was applying to school. So like what Jasmine said, if you guys have any questions, feel free to put them in the Q&A or email us. We're here to help.
Thank you. Sita?
Hi, my name is Sita Bianca. I go by Bianca. It's much easier to say. I'm also a first-year student at the University of Pacific studying audiology. My background, I went to San Diego State University for speech, language, and hearing sciences with a minor in music education. So similarly to Dr. Musakia here, absolutely fell in love with audiology from its relationship to music. So if you guys have any questions about that, I'd love to answer them. I'm also vice president for SAA under President Margie. So yeah, feel free to ask us any questions, and I'm happy to be here.
Thank you. And there is one specific question about CSUN's speech and language pathology masters. It's will it benefit us to try to take classes at UCLA like introductory chemistry, anatomy, and courses such as those prior to applying to the CSUN program?
So would you like me to answer that?
Sure.
Okay, so ASHA, the American Speech Language Hearing Association, does require graduate students to have taken a course in basic biology, but anything that would meet the biological sciences requirement at UCLA would fit that. Also, specifically a course in either chemistry or physics, and a statistics class. The statistics can be taken through psychology or as one of the social sciences, as long as it is statistics and not research methods. And then a humanities or social science course, which I am sure there would be a lot of choices for that. The other class that is in the major that students at UCLA might be able to take would be through the linguistics program, a course in phonetics, and also a course in basic language acquisition, first language acquisition, or a first and second language acquisition.
Thank you.
Otherwise, there aren't a lot of courses that could be taken in speech pathology of those prerequisites.
Thank you. And I saw Gabriella nodding, so I'm guessing it's true for the University of the Pacific Audiology prereqs as well.
Yes, that's correct. So the guidelines for prerequisites are introductory chemistry, introductory biology, and a physics course. That's the requirements for our audiology program. And we really welcome people from all different bachelor's backgrounds. One of our most successful students came from a religious studies background. So what we do at University of the Pacific is we provide everything for you here with a background, with prerequisites, basic prerequisites like you would be available to you at UCLA. We have introductory anatomy and physiology of hearing, and introductory into the clinical process. So we really welcome all students with all different kinds of backgrounds. Of course, with pre-health, you're perfectly positioned to start in an audiology program. And of course, welcome any questions on prerequisites. Usually most of the applicant questions are on prerequisites and money. And so I can answer both of those.
Thank you. What I get mostly from students, how do I know that this is the right field for me? So please, graduate students out there, how did you make sure that this is the right career, the right profession for you? I hear that all of you are very passionate about not just what you study, but where you study it. So just please share some advice with students who are considering this path. So Anna, would you like to start and then see who else wants to chime in?
Sure, that's really it's really a great question. I think I was introduced to speech pathology because my sister was diagnosed with a speech delay when she was younger, speech disorder. And then the speech pathologist included me in the sessions, and I thought that was really fun. But I realized that it was for me when during my undergrad program, we were brought into the community for an immersion program where we worked with people with disabilities, because that particular area had the greatest amount of people with disabilities. And the experience of just being immersed in a community and working with them was so powerful that I knew that this was going to be my lifelong career. So I would say that explore the opportunities around your community, and just get in touch with the people, and you would be able to see if it's for you.
Anyone else would like to add something to that?
I'll go after Anna. She's one of my good friends too. For me, I always had a passion for audiology. I do have a music background, so a professional dance background, but it wasn't until high school where I had a classmate who has a bilateral, which meaning both ears, a sensory neural hearing loss. So she has hearing loss damage in the inner ear, and she didn't have a form of communication. Her only form was sign language, and at times she didn't have an interpreter. So she would just look at the teacher and lip read. And I felt that learning sign language, giving that student some communication, knowing that she wasn't alone, learning it in Spanish and English, I knew this was the field I wanted to be in and help those with hearing loss and their families and help communicate. And so I've always had a passion with audiology. I remember going into Dr. Jin's class for undergrad and I was like, I'm audiology, what do I need to do? Let's go. And she has been there since day one. And I had a class with Dr. Shark Russos and we would talk about audiology. And so this has always been a passion and a heart, but what I love most is exploring, like Anna said, and meeting other students. I met Marjorie via social media. We're two completely different populations we like, but we're really talking so much audiology and help one another. And so meeting other students from other programs or contacting undergraduates, that is the best way of communication because you hear their experiences, they connect you with others. Being part of the board of directors, I have met so many other students and now I'm like, I'm excited to work with you and I'm excited to see where we go in the future. That is the best like reward and experience ever, but also communicating with your faculty in your program on your interests as well. I know I've reached out to my faculty and the placements I've been getting have been great. They are what I want to do in the field and practice. I'm learning so much and growing. So communication is key and exploring as well.
Great. Anybody else would like to add something?
Yeah, I think for me, between when given the opportunity to choose between SLP and AUD, I found that diagnostics appealed a little bit more to my learning type, which not to say that there's not diagnostics in SLP, but I think I found SLP to be a little bit more therapeutically based. And audiology is a little bit different in that aspect. So if you're that kind of person that likes anatomy, likes that, like diagnostic touch. We do a lot of that in audiology. So you may find benefit from doing an observation in a clinic and you can see how it's a little bit different.
Thank you. And we had a Q&A, a question in the Q&A that Gabriella offered to answer live. The question is, are scholarships available to cover program tuition?
At University of the Pacific, we have several scholarship options that range from full tuition to help with textbooks and additional financial aid up to $2,000, $4,000, $5,000. So we have several scholarships that are available. These scholarships, when you apply on the when you apply to University of the Pacific through the CSD CAS system, which is the national graduate application portal for audiology, you'll have the opportunity to select the scholarships that you would like to be considered for. And after that, you will give some eligibility information, why you're eligible for each scholarship. We're also working on offering a diversity, equity, and inclusion scholarship, which should be available next year, which is based on financial need and pooled throughout our School of Health Sciences. So we do have several opportunities, and I would encourage you to definitely look into them. And we're very interested in assisting people who have a financial need to make their dreams come true and to become health professionals in return to their desired occupation.
Thank you so much. In the meantime, I unmuted our students. So now you have the option to raise your hand or ask a question. We have 5 wonderful students here who are willing and eager to share their experiences. So take advantage because they are your best resource when it comes to figuring out what you may want to do with the rest of your life. If you have any questions, please feel free to ask. And Dr. Jin is typing a question for the tuition regarding CSUN, so you're going to get that answer soon. In the meantime, I just want to propose one more question to students. what did you do to explore these careers? Some of you come from similar backgrounds from your bachelor's, but I'm guessing you did some extracurricular activities, volunteering, that helped you solidify your decision to apply to an audiology or a speech pathology program. Can you share some of those experiences, opportunities that you have taken advantage of to make sure that this is the right path for you?
I'll go first.
Oh, go ahead, Margie.
Sorry. So I was a little uncertain about going into audiology. I was like, I don't know if I'm smart enough. I don't know if it's really like what I wanted to do. So I went into a career of ABA therapy where I worked with children that had autism. And I said, maybe I want to be a special education teacher or go into SLP. And I learned that I really liked working with the pediatric population. And then I was like, you know what? Why don't I volunteer at the hospital? So I was able to work as a newborn hearing screener and I fell in love with it. I was like ignoring my love for audiology, and audiology said, this is what you need to do. This is your dream. And so that really pushed me to go apply to colleges. And I would say just observe audiologists if you can, maybe just reach out and say, like, can I interview you? I'm really interested in the field, but I'm not sure if it's the right fit for me. And I know if someone reached out to me and said, can I interview you about audiology? I would say, please. Like, this is such a rewarding field that combines human interaction and science, and you are literally giving people the gift of hearing back. And it's such a rewarding field. Like, I think it's the best job in the world, if you ask me.
You sold me on it. Thank you. Anybody else would like to add something? Sita, yeah?
Oh yeah, I did. Just to hop off what Margie said, I completely agree. I mean, it seems really overwhelming. There's not a lot of opportunities to apply to a lot of programs, but if you just make the right connections and really dive into what interests you about audiology or speech pathology, for me, like, it was like the minute little things about how sound travels. And I had a class with Dr. Misaki, and she nerded out about how sound travels too, and I was like, oh my god, this is my place. And you just have to find the people who kind of take your little ball of passion and kind of just throw the ball with you, and make those connections now. If you have any opportunities to reach out to professors, even from professors that aren't even from your undergraduate program. Like I know many professors from CSUN and UOP, and like even from SDSU would be more than willing to take in any students who are interested in the fields. So get interested in research, get active with the deaf community if you wanted to. Like anything goes for audiology. Like even like the minor things that you feel like might not make you stand out as a candidate will make you stand out as a candidate. So that's something to keep in mind.
I'd like to add something.
Yeah, sorry. Go ahead.
I'd like to add something first. For those who are interested in speech pathology, I think it's pretty similar with audiology too. I would say volunteer, work with speech pathologists. They would really gladly, accept you under their wing and mentor you along the way too. And that also opens up the possibilities. So reach out and maybe look at different settings, whether it's a school, a hospital, or a private practice. So you have that diversity when it comes to like the workplaces, and maybe you'll discover something along the way, like which clinical population you'd like to work with. And also reach out to a lot students also who are in the process, who are taking their graduate programs, because there are a lot of people on either Instagram or Facebook, be part of the groups. I would say explore those, because you really learn a lot from students who are, going through their own journeys as well. So yeah.
Thank you. And we have a question in the Q&A, whether the programs, CSUNs and University of the Pacific programs require volunteer hours at all? So anyone?
Yes. Go ahead, Christy.
Well, that's okay. I did respond in the chat. We don't have that as a requirement. But most of our students do come in with some kind of volunteer or work experience with in helping others. And so our admissions committee looks for that sort of demonstrated interest and commitment. But that can come through in a number of different ways, not just through volunteer work or direct work with, special populations. So I guess, go ahead. I'll, unless one of my students want to expand on that, or if you want to expand on it. Sure.
I think from a career counselor perspective, it's always a great idea to explore a field before you commit to a graduate program. We've been telling our students for years that it will help you in many ways to do some volunteering, get a part-time job, get involved in the community. It's not just that you learn about the profession, but you make connections, you grow your network, you learn from people who are already doing what you think you want to do in the future. So volunteering and being involved, I think, has multiple function when it comes to career development. But if anybody has an even better reason to do that, please share.
I just like to say you brought up a good point about volunteering. I think that's really important. And even with the pandemic, there's ways to still volunteer online and reach out. I think this has been the easiest way for our field to communicate with Zoom rather than traveling or going to conferences and meetings. Zoom has been the best platform for us because we all get to meet nationally and globally. But it's really nice to volunteer. I know for undergrad, I volunteered at the VA a few times. I'm really interested in tinnitus, and I would go to their tinnitus management program. I would connect with the local audiologists who specialize in tinnitus outside of the US as well, and just connect. So it's really nice to volunteer, but also being part of the student chapters. I know for us at CSUN, we have 2 undergraduate reps. So if you're an undergraduate and you want to give back to the community and be part of the NET organization, this would be great. And it helps you connect with other students as well. But being part of the chapter and asking, I know for us, we give surveys, we send Google Forms. What do you want to see? What did you like and dislike about our events? What are you looking forward to, and why do you want to be a member? It's really important because our students' voices matter too, and that's our mission for SAA. And we also been nominated last year from our campus for the Diversity Inclusion Award and Fundraising Award. So all that hard work we went through paid off, but we want to share this award with our faculty and our members as well. So giving back in the community, volunteering, contacting other audiologists, it will pay off and get you a long way. You told me 3 years ago, Jasmine, where are you now from today? It's so paid off, and it's going to continue to pay off in the future as well. So volunteer, I guarantee you it's going to be a great experience.
Thank you so much. We are 5 minutes over, so thank you for your patience with us. Amanda and Aniela, thank you so much for joining us. If you have a last-minute question, please feel free to post now. Otherwise, I'm going to wrap it up to this event. So if you have any other questions, now it's the time. And Kiana had a great comment in the chat. Getting an administrative job at any medical or clinical office is so helpful in building connections and getting exposure as well. It also is helpful in experience with insurances and patient contact. Isn't that true? So thank you, Kiana, for your input. And if there are no more questions, I just want to thank everybody for taking the time to join us today. The recording will be posted on the Career Center's YouTube channel for everyone to see. And thank you so much, and have a great week, everybody.
Thank you so much. Thank you, students.